Well, Jania, just when you think you're in the clear, life throws yet another curveball. And get this, cases of a stomach bug seem to be on the rise. This much coming from lead physician from the Ministry of Health Surveillance Unit, Dr. Felicia Balfour Greenslade. This comes as data from the Centers for Disease Control and Prevention points out a 12-month high of the norovirus in the United States. Now, norovirus, according to the CDC, is sometimes called the stomach flu or stomach bug. Dr. Balfour Greenslade describes some of the symptoms.
You have intense vomiting, may or may not actually have diarrhea. Unlike most of our viruses or bacteria that cause AGE, you would find that they would cause more diarrhea than anything, but you may not necessarily see that with norovirus. It usually lasts about 2 or 3 days.
The CDC also says that the rate of norovirus tests coming back positive in the United States average over 3 weeks was around 17% as of the last week. That's the highest it's been at any time in the last year. That said, it's important to note that the virus is very contagious.
If you're not careful with hand sanitization, if persons are not mindful as to how they leave the restroom after they use it, persons come behind them, or even food. Persons who may be handling food or handling cutlery, and another person comes behind them and uses the same utensils or just touches. The usual modes of spread, fomite, droplet.
She also shares this advice to ensure that you do your part to mitigate its spread.
Good hand hygiene. And in this instance, it would come down to not just good hand hygiene, but also safe food preparation, ensuring that your surfaces are clean, regularly cleaned, wiped down consistently. And if you're having a problem with vomiting and diarrhea and you're in food service, you should not be working.
As for whether norovirus has made its way to our shores, Dr. Balfour Greenslade says they continue to monitor the situation.
We have not gone above our threshold in a way that causes any concern. And the labs report to us consistently as well. So the labs would make us aware of whatever they find in country. We have a grouping that we give information to on a consistent basis to make them aware of whatever challenges may be going on. I saw an article, Read the Problem in the U.S., that was last week. It was shared so that even though we're not having that challenge in country, it was shared to ensure that they are aware that this is a challenge that's happening in the U.S., and to be vigilant if someone does present, they should be sure that they do the needful in taking a good history in terms of food and taking a sample.
And as far as treatment is concerned, it's advised that you drink lots of liquids to replace fluid loss from vomiting and diarrhea. This, according to the CDC, will prevent dehydration. Sports drinks and other drinks without caffeine or alcohol can help with mild dehydration. However, these drinks may not replace important nutrients. Reporting live in studio, I'm Leah Cooper, sending it back to you, Janaea.